Good afternoon, everyone, and welcome to the inaugural webinar by the IOSH Theatre Advisory Group. My name is James Lewis. I'm the chair of the group. We established the group in 2016 and have made some progress with the current COVID-19 pandemic still affecting the theatre industry globally. And having reflected on the last 12 months, we as a group have instigated a change of gear for the group. The following aims: to provide a global forum for individuals who need health, safety and sustainability support, provide opportunities for CPD networking, and to produce industry guidance and advice for practitioners, and to provide opportunities for the next generation of individuals wanting to come into the theatre industry, and specifically roles around health, safety or sustainability, where we will support and nurture their development. We've got an agenda for today. We're going to give an overview of who the committee is, the organisations they're from. Some of the committee members are going to talk about their pandemic reflections. And then we're going to hand over to you to run through what you would like from the group, how you would like us to interact with you, some of the topics you'd like us to concentrate on, or where you think there's a need for some industry guidance. And to be able to do that, there are three options. One, you've got the chat box where you can just drop in some comments or thoughts. Two, Q&A if you have specific questions. We will commit to trying to answer all of the questions, and if we're not able to, we'll try to answer them afterwards and send out some responses. And finally, if you'd like to have a chat to us and interact with us directly, just raise your hand, and Dimple from the IOSH team will welcome you in to be a presenter to talk to us. So I think firstly, if I run through who we all are, I think we are a fairly international and broad spread group. We've got Greg Prochuska and Adam Tackett from NBC Universal that look after shows such as Wicked and Billy Elliot. You've got Hayley Seddon from the Royal Shakespeare Company, Dominique Parasan-Febert from the Royal Opera House in London, Philip Brown, also known as Phil, from UK Theatre Society of London Theatre, Jennifer Mulgrew-Smith from the University of Arts London, Tom Mannings, who's an independent consultant, Richard Beale from RB Health and Safety Consultants, Sophie Louise Filer from Gallup Glass, and finally Ben Harding from ESS Consultants. So I'll move on to the next sort of stage, which is where I welcome some of our colleagues into the room to talk about some of their pandemicking experience. I think Hayley from Royal Shakespeare Company is going to step up to the plate first. Hayley, thank you.
Hi James, thank you. Hello everybody. Thanks for coming along and giving up your lunch to listen to us, talk to you. So as James has said already, my name is Hayley Seddon and I work for the Royal Shakespeare Company. I'm the head of occupational safety and health. And I wanted to share with you today a kind of timeline. It's almost become a bit of a journaling process for me, this actually today, a timeline of what I have been doing over the pandemic and kind of my thought processes as well. So so if that's okay, that's what I'm going to share with you. And this pandemic business started for me really back in 2019. It was quite early in 2019, and myself and the RSC's head of theatre operations were invited to a Warwickshire County Council pandemic training day, and we spent a day with the council listening to speakers from the NHS, Public Health England and the local authorities about what their contingency plans were should we have a pandemic, and that they were expecting a pandemic over the next 10 years or so at some point. And on that day, we were involved in tabletop exercises, and we learned lots of useful things like how the NHS would look to shut down its services if it needed to during a pandemic, and how it would be useful to have backup policies and procedures for sickness absence and things like that. and also to plan for potentially losing up to a fifth of the workforce during a pandemic. So when we got back to work after that training, we added pandemic to the organisational risk register, and did a presentation to our senior leadership team, and came up with an action plan, which was all agreed and signed off. Fast forward a year later then, to January 2020, and we were starting to hear news stories about this new flu virus in China. And at the time, the RSC, we were prepping for a tour in Asia and in the USA, and we had just started rehearsals for our summer season in Stratford as well. And I spent about a week researching and talking to people about this, what was happening in China and in Asia, and reflecting on the pandemic training before I then advised that we actually start following our major incident plan for pandemics. And so we pulled together an incident team who have actually met every week since the end of January 2020. And by mid-February, then we were in full major incident mode at the RSC. And I remember at that time, one of the first things that I had to do was a presentation to all of our HODs. So at the RSC, we have 50 departments. There's quite a lot of HODs. And I talked to them about what was happening in terms of our major incident planning, but also what they needed to start thinking about and doing in their teams. And we held some tabletop exercises with the senior leadership team and with those HODs. But we never, ever, none of us for a second thought that we would be forced to close our doors for a year. A few weeks later, we upped the ante on our cleaning and our sickness absence management, and we had lots of information going out to staff about personal hygiene and reiterating all the public health messages that were coming out. We cancelled the Asia and USA tour, and we were starting to work out the logistics and the technology for getting everybody to be able to work remotely. And at this time, me and my team, we were focusing on helping staff to understand all the public health messaging that was out there. But also at that time, we were keeping a track on where everybody was and who was unwell. We had a lot of travellers in our workforce. So we had members of production teams who were abroad doing recce's. Our education department at that time were collaborating with schools across Asia. And so they were travelling to and from those countries. So it was really important that we could work out who was where, and do some contingency planning and assess the level of risk. The Monday in March then, when Boris told us all to close our doors and close all the theatres, was incredibly difficult, and I'm sure it was for everybody else in the industry. I remember on that day coming out of the room where I was in with the senior leadership team, we're having a meeting, and I walked across the office to my team and told them to pack all their desks and all their equipment away and take them home. And that was the last time that I saw my team in person then, until October last year. And then 2 days after that, I then got poorly with COVID as well. And so it was a very, very strange time. And it very quickly in March went very quiet then as well. So that was a bit of a shock. My team were furloughed along with 90% of the RSC workforce. I wasn't though. I remained in work and stayed at work throughout the pandemic. And I remember a moment sat on my sofa at home, just thinking, goodness, how the heck do I get us through this? How do I help the RSC through this? But then my next thought was, hold on, I can do this. As a health and safety person, this is exactly what I'm trained to do. So, you know, COVID-19 is a workplace hazard, and actually the thing to do is to manage that hazard in the same way that we manage all our other workplace hazards. So I started at the beginning, and with plan, do, check, act, and that was what I needed to do. I needed to put a plan, do, check, act framework in place. So we already had that in place for health and safety at the RSC. So I took what we got already and revised it and reviewed it in terms of COVID. And I mapped out a process then for how we could safely restart operations when we were ready and able to, how we can safely reoccupy our buildings, of which we have 16 at the RSC, so we have quite a large campus, and return our staff back from furlough. And by May last year, there was plenty of government guidance around and coming out as well to help with that. But our first priority really was to ensure that our buildings were safe, the buildings that we'd shut down, and that plant and equipment were safe. So our estates team were very busy at that time. And when we shut down in the middle of March, we were in the middle of a get out in the Royal Shakespeare Theatre. So it was really important that we were able to go in and make sure that the scenery and all the equipment and that were all safe and could be kept. Yeah, they weren't going to hurt anyone whilst there was nobody working in there. And the planning part then took place between April and May really last year, and that included working out what tools and procedures we were going to need to get us back in and get us back restarted in a safe way, to work out how we were going to make decisions as an organisation, and dividing up roles and responsibilities as well. We also had to do a lot of work in terms of comms planning. So how do we get our messages out to staff really quickly, and to our audiences as well? And how do we stay in touch with our furloughed staff? And then we turned the major incident team, who were meeting weekly at this point, into a reoccupation team. And the reoccupation team then were given responsibility for action in these plans. Our doing then, so the plan, do, check, act, so the doing part then started in June, and by June then we were going to open our cafe up for takeaway service, and we were also planning to put on some outdoor performances in our gardens as well. And for that period, there were key to-dos then for me. So it was about getting a COVID risk register in place and making sure that that was up to date, writing new COVID secure arrangements for the organisation, putting COVID marshal systems in place. Training was so important. So I devised induction and COVID secure training for every member of staff. And that included what the new arrangements were, but also how to carry out COVID risk assessments as well. So what does the hierarchy of control look like in terms of infection control? I actually ended up, I delivered about 56 of these sessions in total to every member of staff. But I know, and I'm sure you guys will appreciate that as a health and safety practitioner, being able to see and look every single member of staff in the eye and ask them how they are and make sure that they understand and that they have a moment to ask you any questions or share any worries, that felt like such a priority for me. And so I was really grateful that I was able to work a way out of doing that. I also did some training for managers as well on COVID security, but also how they should or how they can talk to their staff as their staff are coming back from furlough, and how they can check in on their staff in terms of their well-being and mental health. I also set up a COVID section on our RSC intranet, and this is where I put all of those arrangements, and this is where I shared, this is where we pin up our COVID risk assessments, and this is where I signpost to NHS guidance and government guidance and things like that as well. So that's been really helpful. That's been a really important thing to get going and build. I also set up a COVID notification system for RSC staff so that they could report an illness or self-isolation to the company as quickly as possible. So really simple on Microsoft Forms. And then what happens is when someone fills out a form and tells us that they're isolating, Microsoft Forms then automatically sends a note to the IOSH team and HR and occupational health, so that we can quickly do a risk assessment, check in with that individual, and decide then if we need to implement any further action. So it might be that we might need to tell that person's team bubble to also isolate. It might be then that we would need to close a particular area of the estate down and deploy cleaners and so on. So that's been really helpful, so I can quickly know if somebody has become unwell or has been showing symptoms, or is self-isolating. And I also put together an inspection and sign-off regime for each of our buildings as well. So So before anybody was allowed back in the buildings, we formally sign it off as COVID secure. And then I put together a health surveillance policy as well. And so this was detailing the processes that we were following for testing, and also temperature scanning and health declaration forms that we were asking staff to fill out. But really importantly, this policy was then detailing how we were going to process the data, so how we were going to manage the data and keep the data secure as well. The checking and acting part of our management system has just continued throughout. So the reoccupation team meet weekly, and we follow up on any non-compliance, on any blips that occur, and we review constantly. We review the arrangements and the risk register, and make sure that we're keeping up to date with all the legal changes and that as well. And we continue to do this now as we move into step 4. And we've also recently carried out a staff wellbeing survey at the RSC, and that's been really helpful, and really helpful now for us in terms of thinking about how we can really help individuals to just take the time and the space to just reflect on what they've just been through and what's just happened, and start building up resilience again, and you know, and recovering and that. And so that's been a really helpful thing to do. And I kind of just wanted to have a moment where I shared with everybody just how I felt and how I, you know, just this kind of this it's been such an extraordinary 16 months for me. As a health and safety practitioner, I've kind of swung between various extremes of emotion over the pandemic. I felt very exhausted and frustrated, but I do know that I'm not alone, which has been incredibly helpful. And it's been such a challenge. I think that the hardest thing has been keeping up with all of the information and all of the legal updates that have been coming through daily. Actually, it sounds extraordinary, but you know, it's true. That's how it's been. And actually having a network of other health and safety practitioners around me during that period, such as this committee and this IOSH group, has been so helpful. So tremendously helpful. It can feel incredibly isolating, and I felt incredibly alone just in that moment when I was sat on my sofa, panicking almost in March that I wasn't sure what to do next. And to know that you're not alone with that, and that we're all starting from scratch and we're all starting from the beginning, has been incredibly helpful. And the RSC is very diverse as well. So as well as keeping on top of the performing arts guidance, I've also had to stay on top of all the other guidance and changes that have come through, because we put shows on, but we also have catering and hospitality functions. We have a retail function. We construct things. We do maintenance. We have maintenance teams that work in other people's homes, because we are also landlords and we rent properties out. And we have transport, and we also run a children's nursery as well. So I've also had to make sure that we're on top of all the education guidance and legislation that's coming through, and how the early years industry has been managing the pandemic. And then at the other end of this spectrum of emotion is my feeling of immense pride. So not only for myself for hanging it on in there and still being here now with a big smile on my face, but my pride towards the industry and towards my colleagues at the RSC as well, kind of remembering also that in the midst of all of this pandemic, every single one of my colleagues at the RSC has also gone through a restructuring process, and we've seen many redundancies. So although technically I did see this pandemic coming, I never for a second acknowledged the potential scale of its impact. But at the same time, I also never quite realised how amazing and resilient we can all be in the face of adversity. And that is something that will stay with me, I think, for always. So I am going to stop talking now and hand over to Phil, who is going to share with you his experiences.
Thanks, Ellie. Hi, everyone. I'm going to kind of reflect on kind of the past 6 months in 2 parts for me, just to give you an insight into who I am and my role. I'm a chartered fellow of IOSH. I work for the Society of London Theatre, which is fundamentally the West End of London, and all the theatres that are based there and all the producers that are based there. And I also work for UK Theatre, which is pretty much the rest of the country, so all of the nations around the country, all the regional theatres. And I'm classed as a member resource. So members can come to me for free advice and support for a huge range of health and safety related issues and risk management issues. And I suppose the one word I would say for the start of this crisis for me was frustration. So quite early on, my employees decided to utilise the furlough scheme, and for probably what is the biggest health and safety crisis that I've ever had to experience and our industry's ever had to experience, it was very frustrating that I was kind of put on furlough quite quickly. Now, if someone had said to me a few years ago, you can be at home on reduced salary, obviously our salaries are reduced salaries, not having to work for 4 months, probably most people would have bitten everyone's hand off. But for me, that was a huge frustration. I had friends who were losing jobs. I had friends who were going through restructures. There was obviously the members who needed support and advice on health and safety, trying to deal with the COVID crisis. And the main frustration for me is I couldn't do what I normally do, which is support and help people. I also experienced some personal issues. My older brother sadly passed away through cancer-related illness, but obviously had COVID. And I also experienced panic attacks, never experienced panic attacks in my life. And I think it was a build-up of job worry. Obviously, the longer I was on furlough, the more I started to worry about, do they actually need me back? There was obviously all the stuff that was going on within the industry, and obviously colleagues from the committee were experiencing, which I couldn't support. And obviously all of the things that were going on kind of inside my head about what was happening, what wasn't happening. And I kind of, it took a long time to get used to all of that. And I think I used the line, bit of a throwaway line, but I think it's okay not to be okay. And I think that's something that I kind of had to deal with. And my garden started to look a lot better and managed to have a nice crop of tomatoes. So that kind of helped me through some of that frustration. So for 4 months, a lot of kind of anguish about what was going on in the industry and personal anguish that was going on. And then back in October, I was brought back into the fold, which was great. And that kind of did kind of support my own mental health. And then obviously I could then move on to helping the rest of the industry. My job, obviously I don't run a venue, I'm not producer. So as a member resource, we had to then start to think how we were going to support the industry to move out of the crisis that we were in and try to get back to some kind of sense of normality. So my role then started to liaise a lot closely with the Department of Culture, Media and Sport. And I was part of 4 working groups that were looking at how we could move away from what was a main struggle for the industry into kind of some kind of normality. So we had a group that was looking at science, and that was looking at all the aspects of science like testing, isolation procedures, all those kind of issues. We then had a group that was looking at performers and performing companies, so all the aspects of back of house, front of house, all those issues that they were dealing with. We then had a group that was looking at audience behaviour, how we were going to welcome audiences back and how we were going to reassure them so they felt safe coming back to theatre. And then the final group was looking at touring. So we met on a weekly basis with representatives from DCMS, including the Chief Scientific Officer, Tom Rodden. And having that kind of close connection meant that we could put across some of the frustrations that we were experiencing within the industry. But more importantly, we could drive some of the changes in order that the performing arts guidance, which was the key bit of guidance information we had, we could help draft and drive that change to make it a workable document for the industry. So those groups have been ongoing and they're still carrying on, even though obviously things have changed over the last few weeks. Another thing that we decided we needed to do was to give some education to the industry. So we created a 3-hour COVID course, open to anyone, and we kind of started that in October. So when I came back part-time, started that in October. We've then carried on that all the way through till the end of June. And at the end of June, we trained over 600 people around the country, from the professional world, non-professional, venue operators, union members of staff. And the whole idea of that was to give people in 3 hours a snapshot of what COVID was, an overview of how the health and safety framework that we're all working to, and we've worked to for a number of years, how that can help look at COVID and how we can manage that going forward. And then the final part of the course was to look at the mitigations, what we needed to do in order to keep all of our staff, all of our customers, all of our visitors safe, and try to reduce the risk of COVID spreading in our productions, in our venues. And that was really successful. And it was really nice to feel as though I was part of the solution to what was going on within the industry. Having that reconnection with venues, having that reconnection with workers within the industry was really good. And it kind of, I suppose that did kind of give my own self-worth a bit of a boost and made me feel better that even though I'd missed 4 months of this crisis, being back on the cold face, meeting staff, even though it was via Zoom, it did make me feel as though I was back helping and supporting people. So that was a major part of work. I guess the next thing that we are working on as our next steps is what have we got left. So obviously the performing arts guidance, as you probably will be aware, is now gone. We've now got a new guidance document, which is about events and attractions. And if anyone has had the fortune or misfortune to read it, it kind of brings its own pros and cons. I think for a while we were kind of saying to DCMS, we wanted to manage this problem ourselves. So stop giving us guidance. We know how to run things. We know how to manage things. We know how health and safety works and risk management works. So on one hand, they've kind of given us that with the events and attractions guidance. But then we've got lots of people who are now saying to us, now we haven't got guidance, what do we need to do? And I think for the next few weeks and months, a group like the IOSH group is going to be at the forefront of supporting members and non-members to see how we can steer our way kind of into, again, a sense of normality. We've got some massive challenges. Obviously, I don't need to tell you all about the issues with the NHS app and the pings, how that's having a huge impact on venues. You know, you've probably seen in the press, productions are being closed down, rehearsal rooms are being closed down, venues are having to shut for an extended period of time. That's a massive problem. And that's something obviously that we might be able to resolve in August when the rules change, but obviously that's still nearly a month away. So that's going to be a problem for the next few weeks. Obviously the changes in exemptions for travel. Obviously we've got a lot of travel and coming backwards and forwards from different parts of the country, performers going in and out. That's obviously something we need to be looking at. And for me personally, I think one of the big issues we've got is there's a shortage of staff. And I think we're seeing some venues are struggling to recruit front of house staff, back of house staff, and then the staff who are coming back, we need to make sure that they feel supported and they feel confident and competent in order to do their jobs. So it's great to be back. I'm now back full time. So I'll probably, you're damned about what you wish for, but I think I'm very glad to be back full time. I think there's some massive challenges. Obviously, I think all of us are up for those challenges. And I think the future of this group is going to be there to support safety practitioners within the theatre world, and perhaps not so much in the theatre world, affiliated industries as well. And I think we were all up for the challenge, and we look forward to kind of supporting you going forward. So I'm going to move on to the next speaker, who's going to give you a slightly different flavour of things, and that's Greg.
Thanks, Phil. Good afternoon, everybody. Good morning for those of us on this side of the pond. I am the Director of Environmental Health and Safety for Universal Theatrical Group, part of the NBC Universal family. And my experience during pandemic has been a lot like everybody else's. There's a lot of uncertainty and new regulations on a daily basis, and what do we do with all of this information, which leads to information overload. But I think one of the benefits that I've been able to have throughout this process is that the company as a whole works on so many different, so many different mediums, television, film, live theatrical, that early on in the pandemic, our production and health and safety department made a really pivotal switch to, okay, it's early days, but what are we going to do to bring television production back, to bring film production back, and to bring theatrical production back? So looking at the science, looking to industry leaders, looking to anybody that we could to try and figure out when we're ready to come back and can start coming back to production, how can we do that? So my team and I were a part of the early days of putting together plans for the entirety of the company. So what does that mean? Part of that was we have major film and television hubs all over the world: Australia, the United Kingdom, the US, and Canada. So some of us became experts on each of those different areas. Because of the work that I've done in the United Kingdom, I became the UK expert in looking at their guidance almost daily to see how it was updated and how that might affect plans. A colleague became an expert on Australia, so on and so forth. And we would compare notes on a pretty regular basis to put our company plan for return to production together. And then every single production used that as the basis for what they wanted to do to bring themselves back to work. Apologies for looking sideways, I'm looking at my notes. There were a lot of things that needed to be looked at in all of that. And sometimes it was the difference between the CDC, which is Centers for Disease Control, which is the regulatory agency here in the US, versus what the World Health Organization, the WHO, advised. Looking at what the HSE in the UK advised versus what OSHA, our equivalent here in the United States, advised. All of that needed to be taken into account. All of that needed to be taken into our planning process for when we wrote a plan that would work globally for all of our hubs. So for example, certain countries in the world required a mental health section in any post-pandemic production plan. So in order to make this a global plan, whether or not mental health was required in a specific area, like just ballparking here, I'm not accusing anybody, but Canada versus the UK, if it was required in the UK, then it went into our plan because we operate in the UK and we wanted one plan that would be able to, for the most part, from a production perspective, not regulatory, be used across all of our locations. After plans were formalized a little bit more, we pivoted to working on some post-production stuff. Everybody thinks post-production on the film and TV world is mostly office work and it doesn't really need a lot of health and safety oversight, but you would be surprised in a pandemic what that means. Orchestrations are not as easy as they used to be. Bringing a 60-piece band into Abbey Road Studios to record for a major film score, gone are those days. So how do we make this work? How do we make post-productions work? And at the time, I really didn't, it was something to do and it kept me busy. So yes, absolutely, we can do this. I didn't realize until much later on the impact that would have when we were ready to bring live theatrical productions back. I have this wealth of experience having worked with orchestras across the UK, Europe, the United States, and Canada, and all of the different regulatory agencies and musicians unions that have come out with their own guidance that now I can put into place for bringing our theatrical productions back. That was a little bit of a gem that I didn't realize at the time was going to end up being beneficial in the long run when we brought live theatrical back. We as a company have had to have a plan or a playbook approved for every production. And while TV and film came back a little earlier than live theatrical, someone still needed to review all of those plans in conjunction with our corporate EHS function, our business continuity and crisis management team, our corporate medical team. Since live theatrical was a little bit slower to return, there's been a lot of plan review that has been in my day-to-day. That has been really helpful in putting our plan for all of our theatrical shows to come back as well. So I think there's been some great knowledge that I've gained over the course of the pandemic that I didn't really realize when I was doing it would be as helpful and beneficial as it currently is. Those are all the good things. The potential setback for me has been a rise in anxiety and a feeling of being overwhelmed. Not in general terms, but I've been living the pandemic, as we all have, but I've been living the pandemic in a, okay, what do we do to get everybody back? Pretty much since April of 2020. And that has lately led to a very real sense of, while that has not been everybody else's reality, it has been mine, and it has been an overwhelming experience to help people get there throughout this whole process and continue to get people there. So I'm trying to now find ways for myself to take steps back and recharge, do things that I wouldn't normally do, like have time where I say, nope, this is my time. I cannot respond to anything right now. I am taking this hour to myself, because we all rush to help the industry's return and didn't take time for ourselves in that process. So as much as I was doing research on how we could help from a mental health, mental well-being perspective across all of our productions, I wasn't necessarily taking that time for myself. And that became a really hard-hitting realization in the last couple of weeks. And it's something that I have now needed to look at for myself, given everything that has gone on during the pandemic. Yeah, I think that's been my experience so far. I'm very much looking forward to having my theatrical productions back and having that be my day-to-day. As much as I love TV and film, they are not the same, and I cannot wait to be back in a theater setting full-time. Having this organization and this committee has been especially helpful, because even when we met remotely, it was still an opportunity to talk to colleagues and chat about stressors or things that we were all being met with as challenges, and how we were all going to get through them collectively. I am a big fan of R&D, rip off and duplicate. And if I've had this experience and it's been a challenge to work within regulation X, Y, and Z, I want to share that with all of my colleagues so that we don't have to all hit our head against the proverbial brick wall to figure out the collective best way forward in that regard. So having this group and some of the others I sit on here in the US has been incredibly helpful for me. I think that's it for me. I'm happy to answer any questions that people have, and I'm going to turn it back over to James.
Right. So everybody, if you've got questions for the three guys that have just talked, please pop them into the Q&A, and we'll circle back to them at the end. I think one of the things that we're really keen to hear from you guys as members of IOSH, but also potentially members of the Theatre Advisory Group, is really how do you want us to support you? What are your thoughts on topics that you need support on? Is there a preferred way that you want engagement with the group and the committee, other members of the membership portfolio? Really, it's sort of handing over to you guys. If you want to talk to us directly, just a reminder, please raise your hand, and Dimple will pull you into the chat, and then the page to be able to speak. Again, if you've got questions, you can pop them in the Q&A, and if you've got thoughts or points that you want us to cover as part of the discussion, please pop them in the chat. Dimple, and I can't see hands, so I'm assuming you're going to manage that. I think one of the things we did previously do while you guys are having a think about how you want to engage and on what you want to engage, we ran a survey pre-pandemic on perhaps thoughts, topics, and areas that the industry and colleagues and members may want some support on. So Adam, perhaps you can quickly run through that with the attendees while we talk about while we wait for some comments and questions.
James, there's a question in the chat.
Oh, my technological failures there.
Anxiety and stress to come back to the workplace is high. How do we equip our HODs and management to speak openly about this and highlight the importance of flagging up mental health concerns in the way you would physical health and safety concerns? Were there lessons learned, practices that worked better than others?
Hayley, Phil, Greg, who wants to take that one?
I'll start, because at the RSC what we've done is we did a wellbeing survey in March, and it was so helpful. In the past where we've done staff surveys, HODs, managers, senior leadership team, all of us really have been a little bit nervous about it. You know, you're asking questions and you know that people are going to speak speak their truth and that, and you have to be ready to hear what people say. We just bit the bullet and went for it in March and asked really straight to the point questions. You know, how is your mental health? How are you feeling? How emotionally safe do you feel at the moment? And the response that we got was so overwhelming and so brilliant. So I would highly recommend a staff survey as a way to start that conversation. Excuse me. And to then, so to not only start the conversation and give staff an immediate place to start to offload and talk to you about how they're feeling and what they would like from you, but also that it provides you with a great kind of pick and mix of things then for you to start thinking about actioning and you know, and to start thinking about, right, what can we put in place, how can we make this look tangible. And of course then our plan is to do a survey next year, or maybe in 6 months time even, and then we can also benchmark ourselves and against that original survey. So that would be my start of the 10.
And Hayley, are there any, just going perhaps to the second part of that question before we move on to Alistair, who's sitting patiently with a raised hand, is there any practical examples you can give that have really worked as support?
Yeah, so what we found in the survey, so we had a lot of people asking questions around counselling services and things like that. What kind of support is available, where so signposting is really important now. So we've been making sure that people are fully aware of our employee assistance programme and how to access services there, and access services through occupational health. And there was one real key topic and theme that was coming through the survey was around connection and feeling connected. So we are working really hard at the RSC to make sure that that staff have ways to connect in with each other, but also with their managers, and that that senior leadership connecting with the managers as well. So over the summer now, we're looking to set up a line manager networking group internally. You know, so it's things like that we're developing now.
Thanks, Hayley. Alistair, over to you.
Good afternoon, everybody on the panel. My name's Alistair. Until I'm relatively new to health safety as a profession, I was very lucky during sort of the pandemic. I gained a job with a specialist health safety company working in the entertainment sector. Before that, I was a stage manager, production carpenter, and production manager. Looking forward, coming out of COVID, I know we've still got a long way to go. Talking to a lot of my colleagues who are still in the industry, there seems to be a lot of worry about the lack of staff that are still available. And that leads on to kind of working hours. And we've known for a long time, especially from the touring community, which is where I base myself, that for years, producers have really, shall we say, bent to our better judgments to achieve the timelines they want to, at potentially the risk of our well-being. And I was just wondering, what's the committee's view in light of SALT renegotiating contracts that may well come, look to be coming up to renewal in sort of a couple of years' time for the coronavirus? Is there a chance that we could look at working hours and really protecting them? Because for years we have had guidance and government working regulations, but let's be honest here, for a lot of people in theatres, you are made to sign out of them, and therefore the protections aren't actually there.
Thanks, Alistair. Phil, do you want to pick that one up?
Yeah, I will say I've got nothing to do with the union negotiations. That's gladly left with other colleagues to deal with. Alice, I think this gets brought up in lots of meetings. I think that a lot of the board members who obviously sit on the SALT and UK Theatre board, who run venues, run production companies, they're acutely aware that during the crisis, people have left or people have been furloughed, got other jobs that were 9 to 5, and perhaps they've enjoyed that, seeing their family at weekends. So I think there's a lot of work to decide how we move forward. We as SALT and UK Theatre, we're doing a lot of work with PIPA, who obviously have done a lot of work with working mums in theatres, but they're expanding their work to look at hybrid models of working, job sharing. So there's a lot of discussions that are going on behind the scenes with lots of board members. And I guess what will come off the back of this, there will be some guidelines and some recommendations that SALT and UK Theatre will make. But I think that the main focus at the moment is getting us past this main crisis that we're still experiencing, not ignoring the fact that obviously there is going to be some job shortages and some skill shortages. I think we're acutely aware of that. And there, as I said, there is lots of work that is happening. So I probably haven't answered your question that greatly, but I think it is something that as an industry we are kind of struggling a bit with, but are trying to find some solutions about how we can change the working patterns across the UK.
Greg, is there an international spin you can pop on that?
I think it's always been a challenge in the industry, right? It's not something that is new. It's not something that we're just now starting to talk about. I think, as I have tended to refer to the pandemic as the great pause, we've paused for a long time. And as we come back to work and everyone's focus becomes on the anxiety and mental health related to the cumulative stress and trauma that we've all collectively been a part of the last year, when we focus on people's mental health and well-being, sort of hand in hand with that comes working hours, because you can't be mentally well and physically well if you're working to exhaustion. So my perspective is while they're not 100% tied together, there is some piggybacking that can go on with these two topics. And I would look for ways that you could talk about hours through mental health perspective, because that seems to be the hot topic of conversation right now. We do have a question in the Q&A while I'm unmuted from Anthony. What are the panel's thoughts around entry passports to venues? Anybody want to?
Well, I'm happy to give a sort of an overview, perhaps. I think as with all things that could be seen as being pushed towards vaccines, maybe, I think there are some pros and cons. I think for the UK government, and let's just talk specifically about the UK, because in the US, I think you've got 52 different ways of doing this, depending on which state you're in. And internationally in Europe, there's a possibility of a single passport. However, I think that there are a lot of pros to it. There is a known risk associated with people that have not tested regularly, are unable to provide any sort of validation of their current sort of infectiousness versus somebody's ability to provide information on their vaccine. I think it provides a neat way for an organisation that's looking to make a risk-based decision on audience members and staff, a way of showing that current status. And I think that they're the benefits. I think that the potential negatives are that it can be seen a little bit as pushing the vaccine agenda into existence, and people feeling that they're being forced into having a vaccine rather than having a choice, which I think is perhaps where that question is coming from. But the app itself doesn't only allow vaccine status, it's COVID test status as well. But if you can prove that you've had that negative PCR/lateral flow device that identifies A, have you got the virus currently through PCR, and B, are you currently infectious through a lateral flow rapid test? I think that's a really valuable tool for a venue. Phil, your hands up.
Yeah, just to kind of add, it's creating lots of discussions within the industry, especially with the venue operators. There's definitely some venue operators who will be doing it. The Ambassador Theatre Group have announced that they will be doing it across their portfolio. Some of the other venue operators are looking at doing pilots to see how it works over the next few weeks. I think the one thing I would add about the passing the current events guidance is the throwaway line that says government can mandate this in the future. So if organisations don't take this up, they already mentioned on Monday about nightclubs having to mandate doing this. There is a huge risk that the choice will be taken out of our hands within the theatre world, and we'll have to follow this COVID pass scheme anyway. But it's definitely create a lot of diverse discussions about who should use it, who shouldn't use it. Is it excluding some people who might not have had their second jabs because of a multitude of reasons? So I think it's not there yet, but I think it's definitely on the agenda. And I know there's a meeting going on with DCMS this afternoon, and that's definitely on the top of the agenda to talk about how that's going to play out in the theatre world as well.
Thanks, Phil. I think there's another question which is in the chat, which is relating to a small theatre out in the regions run by trustees that has a cafe. We're a small team, and have we, as a group of panelists, got any specific hints on how to help them look at the mental health of and support positive mental health of the people who work at that small theatre? I think specifically in the cafe, if I look at the chat. And I think I'm happy to take the first pass at that. I think it's a little bit of what Hayley said, which is try to understand what the concern is. Anxiety is a lot of worrying about the future and worrying around uncertainty, and depression is generally a lot about worrying about the past, things that have already happened that impact on an individual. I think if you can sort of start to try and assess what's causing that concern, it'll give you some starting points to look at how to address it. Again, practically, Hayley, perhaps if you want to pick that one up, are there any sort of, for a small organisation with, I imagine, an incredibly limited budget, if any,
Yes.
what are some of the sort of practical tips and hints that we can give?
Well, I was going to suggest kind of going out and looking at what free resources are out and about. So there's a number of charities in the UK certainly that offer free resources for workplaces and for line managers and that. So so Mind, the mental health charity, if you had a look on their website, they have a section of resources for workplaces and managers. We use their wellness action plan template that they have that you can download for their website. And that so that's a really good way of kind of, it's a really good tool for starting a conversation with a member of staff about how they're feeling and what kind of things might be triggering mental ill health or could be triggering for them at work, and then really getting down into the nitty-gritty then of what actions you can put in place that they can do when they're at work and that you can do then as their manager. So I would highly recommend having a look at that. And Samaritans as well, they have a lot of resources on their website. They have things like listening tips and stuff like that. So I think kind of going back to what James is saying, if you can understand what's causing anxiety or causing concerns, and then have a think about training and maybe calling on some of those external resources that are out there. But the key thing for me is to remember that we are not psychologists and we are not medical practitioners, and there is no expectation for us or for line managers to fix a person's mental ill health. That's beyond what we do. Well, certainly me anyway, I'm not trained in doing that. So it's about recognizing that and accepting that and knowing where to signpost a person, so knowing what primary care support that is out there that they can be signposted to.
Greg, do you want to come in as well?
I was just I'll echo everything that Hayley said and look for where your local resources might be as well. In addition to national ones, there's always local resources that might be willing to partner with you for specific instances. I'm a huge believer in just bringing it to light and talking about it. And that will, as a whole, help the industry deal with everything that it needs to when it comes to mental health. We do have, 2 additional questions in the Q&A. What does the panel think how productions can deal with tension between staff members who want to keep mask wearing and other staff members who want to just get back to normal in light of the very vague government guidance?
I'll have a go at that. So for us, I mean, I think at the moment we've got 700 or 800 members of staff, so 700 or 800 different concerns and opinions and worries and that, and you're not going to find a solution, a policy that is going to make everybody happy. So firstly, I think it's just accepting that and doing the very best that you can. But for us at the RSD, and certainly for me, it's been about building trying to build a culture or trying to build a mindset where we're all in it together. So everything that you're choosing to do is not for you, it's actually for your colleagues and for the people that you're working with. And so that's really been my kind of theme throughout the last 16 months, to get people to think about what they're doing in terms of other people, and not just yourself. It's really difficult, isn't it? And sometimes you have to be assertive, and it's like, well, actually, really sorry, but when you come to work, sometimes we have to leave our personal opinions at the door, and we do have to follow the procedures that are in place to keep ourselves safe and that. So occasionally, as a health and safety practitioner, you have to use that line, don't you? But really, it's about trying to build those connections and get us to think about each other first.
Thanks, Hayley. I think just looking at the time with 2 minutes left, perhaps if I draw it to a close, I can see that there are still quite a few questions. We'll endeavour to try and get those answered and provide a view afterwards to you guys. I think there are perhaps two clear themes which I can derive from some of the questions we've received. One is well-being, mental, physical health. How do we deal with this in large organisations, right the way down to the small regional charity-based theatres? I think that's one topic that we'll certainly concentrate on. And then the other is perhaps a little bit around COVID still, and how do we provide some practical tips and hints, and perhaps some guidance for specifically the industry, where the DCMS entertainment guidance perhaps doesn't provide that. And I'm going to assume that perhaps some webinars around, or just panel discussions with colleagues again over the next couple of weeks and months might help support and answer that with perhaps just question and answer sessions. I think if there's anything else anybody wants to go through from the panel, I'd just like to thank everybody for their contributions today, specifically our two vice chairs, Phil and Hayley, as well as Greg and Adam doing some question wrangling for us as well. I hope you've got out of it what you want to get out of it. Thank you for coming along. Phil's just dropped his email into the chat as well. So if there's anything you'd like specifically to get hold of us and to talk about, Phil, thank you for volunteering your email address. Perhaps everybody, you can drop Phil a note on specific topics or engagement methods. So finally, thank you ever so much for taking part in today's webinar. It was great to meet some of you and see you again shortly in the future. Thank you.